We are geographically isolated. We are 2 hours from Boise, so if there is a drawback to living here, access to services is a challenge for our patients.
And that's partly why when Dr. Priest and Misty started coming here, that was huge for a lot of those patients, because we've had patients with cancer, for example, who know that they need treatment but won't go to Fruitland or to Boise until spring because of the roads.
For our patients, I think that's the biggest thing, when they don't have to travel. And so many, his patients specifically are elderly. That's the majority of his patient population. And when they don't have to travel, that's a really big deal.
I think the big advantage that St. Luke's brought us is partly the medical record. I've had patients this week that see a cardiologist, and we're updating the same medical list, and I could send a note on the electronic medical record to Dr. Nolan, who's this patient's doctor, at the end of my visit and say, hey Brian, here's what I changed, he'll see you in 6 months for follow-up. And I think that continuity of care and kind of the universal location is really going to be important. I think St. Luke's organizationally has allowed us to do things that as a single clinic we wouldn't be able to do.
We have access to care and our patients have access to care that's state of the art, and that's huge for rural communities, and I think it should be that way.